So depression is a very common phenomenon. Virtually everybody's experienced some element of depression in a mild way. It involves a low mood, typically social withdrawal, what's called anhedonia, which means lack of pleasure in life. People want to stay at home, not to go out, not to meet people, and they often have low self-esteem. So they think that they're not very good at whatever they're doing. They're not very clever. They're not very pretty. They're not attractive. They're not successful. All these are kind of typical features of depression. So typically, people with depression are withdrawn and very self-critical. They think they're not very worthy, that they're not valuable, that everybody else is better than they are. Well, depression will typically have these sorts of features, that they will look withdrawn, down on themselves, not happy with life, not socially engaged, and they will tend to be down on themselves, basically, very commonly. So typically in depression, people have what are called cognitive distortions. If you ask somebody who's depressed, how good are you at your job, or how attractive are you as a person, they'll place themselves much lower than the average. So it's kind of like you're comparing yourself with the average, and the average person by definition should be about average, but if they're depressed, their perceptions of themselves will be much lower, and they'll say, I don't think that things are going to work out for me. Everybody else is much better than me. My prospects are grim. I'm not much good. Those are typical sorts of thoughts of a depressed person. So one fundamental element of cognitive therapy is to understand that the way that we feel is powerfully influenced by the way that we actually think. And so these thoughts, I'm not very good, I'm not up to much, are often just false. And when you help the person to understand these what are called thinking errors or cognitive distortions, then they typically feel rather better, because they begin to think, actually, my view previously that I was the worst at something is entirely mistaken. And actually, I've got some value and I'm much better than I thought. And then when they think they're much better than they previously thought, they tend to feel more positive and more optimistic.